Let's talk about epilepsy. Do you know someone with this disease? Stay in this video and you will learn everything you need to know. Epilepsy is a chronic neurological condition characterized by recurrent seizures caused by abnormal electrical activity in the brain. This condition affects people of all ages and can significantly impact the quality of life of patients and their families. How often does it occur? Epilepsy is one of the most common neurological conditions worldwide, affecting approximately 50 million people globally. It can develop at any age, but it is more common in children and the elderly. Factors such as brain injuries, infections, genetic predisposition, and underlying medical conditions can increase the risk of developing epilepsy. What are the most common causes? There are several types of epilepsy, each with distinct characteristics. Epilepsy can be classified into two main types: generalized and focal. In generalized epilepsy, seizures affect both brain hemispheres and can cause loss of consciousness. In focal epilepsy, seizures begin in a specific area of the brain and may or may not affect consciousness. What are the symptoms? The clinical presentation of epilepsy can vary widely depending on the type and severity of the seizures. Common symptoms include generalized tonic-clonic seizures, where the patient loses consciousness and experiences intense muscle contractions. Focal seizures, which may include uncontrolled movements or abnormal sensations, and absence seizures, where the patient appears to be absent for a few seconds. How is the diagnosis made? The diagnosis of epilepsy usually involves a combination of a detailed clinical history, neurological examinations, imaging tests such as computed tomography or magnetic resonance imaging, and electroencephalogram, which records the brain's electrical activity. How is the treatment done? The treatment of epilepsy aims to control seizures and improve the patient's quality of life. This usually involves the use of anti-epileptic medications, which help prevent the occurrence of seizures. In some rare cases, surgery to remove the area of the brain responsible for seizures may be an option, especially if medications are not effective or if a specific brain lesion is identified. How to deal with a family member with epilepsy. Patient and family education about the condition, identification and prevention of triggering factors, and emotional support are equally important in managing epilepsy. Epilepsy is a common neurological condition that can significantly impact patients' lives. With an accurate diagnosis and an appropriate treatment plan, many patients with epilepsy can live full and productive lives. However, it is important that it is recognized and treated early to minimize the risk of complications and improve long-term outcomes. We would like to hear your suggestions on what topics we should cover in our next videos. Leave your comment, subscribe to our channel, like and share. Follow us on all social networks, watch our various videos about everything you need to know about neurological diseases, mental health, and neuroscience. Oh, don't forget to save this video to review when necessary. Thank you.